So I'm Reuben Sutter, and I am a psychiatrist. I'm board certified in general adult psychiatry as well as addiction medicine, and I am the medical director here at Sage Neuroscience Center. I have a panel of my own patients that are general adult psychiatry, but also assist in the detox clinic for our substance use disorders service, and I also supervise the services for transcranial magnetic stimulation. My favorite part is working with individuals. What is exciting about doing psychiatry, I feel, is that you get to meet people from all kinds of walks of life, from all sorts of backgrounds that you never really would get the opportunity to do otherwise. I mean, individuals are fascinating, and people are amazing. And what is really gratifying about the work we do is that we're really engaged in trying to alleviate suffering. Mental health suffering, psychological anguish that people go through is tremendous. It can be overwhelming, and to really be engaged and be able to work with somebody to address that and to see them find hope and to begin to experience recovery is incredibly gratifying. What I love most about Sage is that pretty much everybody that is here wants to be here and has a passion for what they do. A patient of mine some years back had said that mental health stigma was the last remaining stigma. And on some level I would have to agree, in the sense of how oftentimes people end up suffering alone with mental health issues and don't feel that even the individuals closest to them understand or can provide support. And you combine the pain that comes with suffering like that alone, and seeing that people around you either don't support it or don't understand it, it becomes intolerable. And I think that is largely what leads to thoughts about death and wanting to die, and thoughts about suicide, that if you really don't have that support, if you don't have that network to back you up, and you're having a hard time tolerating all of this in the first place, and people don't understand or don't support, I completely understand why somebody would say, I don't want to continue living anymore. If a place like this can step in and say, we do understand, or we're trying to understand, we want to listen, and we want to provide support. If at the very least it's a surrogate community that we can step in and be that network of support and understanding, and even provide education, and hopefully loop in that support network, that family, the friends, to educate them, to begin to alleviate some of that suffering. That's, I think, really the crux of the matter.